Hi, my name's Ryan Wallace and I'm here today at Paradigm Clinic and I'm getting a hair transplant to cover up scarring issues on my cleft lip and palate. I was recommended Paradigm Clinic by my surgeon Chris Hill. I then researched into more of what they provided. They specialised in hair transplants, just scar tissues, which is what I was exactly looking for.
We're now with Ryan, who's day 7 after moustache reconstruction. As you remember, Ryan was born with a bilateral cleft lip and palate and has had an absence of hair in the middle third of the upper lip. Ryan's goal was to try and improve the appearance and disguise the absence of hair in the upper lip. So to that end, we harvested hair from the underside of the chin and we transplanted that hair into the upper lip. So he's now day 7 post-op. Ryan, how's recovery been? What was it like?
Recovery was fine. Numbness on the lip for the first 3 days. That's about it.
Yeah, okay.
Bit of pain under here for the first 1 day, and then all the red dots from taking the hair follicles, they disappeared and completely blended in with the hair that was already there.
Very good, yeah. And looking up towards the sky, yeah, you can't really see the donor side anymore, sure you can't. It's nice and faded in very quickly, wasn't it?
Very quickly, yes.
And what about the numbness now? Is it all totally settled?
No numbness, no.
No numbness?
About 3-4 days.
3 or 4 days, yeah. And did you need painkillers or anything like that?
Painkillers for the first day, just for underneath the neck.
Just for the first day, okay,
That's
super. And the first day you were spraying the upper lip, isn't that right? And then thereafter you were just showering as normal, isn't that right?
And every time I got food on the lip, I'd spray it again just to make sure it was clean.
Excellent, good, yeah, good. So now the sensations return, there's no pain issues, and because we're day 7, we can see there's little bits of dry skin there, and some little dark bits again, that's partially dry skin, partially little bits of blood, but the grafts are taken now at this stage. They will have a blood supply and they will grow. There's no sign of infection, which is great, and there shouldn't be any major risk of infection going forward. As you can see, the appearance is already much better, even just with the smaller dots of hair that there are at the moment. Once these hairs start to grow in about 3 to 4 months, they'll come out to this type of length, which is a centimetre or so, and it'll be really significant improvement from a pre-operative state. What about eating, Ryan? Any issues with eating over the last week?
The first day or 2 I had soup, some noodles, nothing big. And then after that, everything seemed to be back to normal. Nothing too huge, no big burgers. But everything I could put in my thought of spoon, was grand to eat.
Perfect, no, that's great. So that's super, you've been able to get back to eating and things. And some patients might inquire about other oral activities such as kissing. That might be left for about 2 weeks post-operative, partner permitting, of course. All right. Any other questions, Ryan?
When can I go back to the gym?
Back to the gym. I'd be happy to go back now, anytime. Be fine from that perspective. So in terms of time out of work and socializing, it's usually 24 hours for this type of procedure. In terms of exercise, about 7 days. And sunlight, best to avoid any sunlight in case you get increased pigmentation around the scar area. So but it's most unusual to have that type of problem, to be honest with you, hyperpigmentation in a scar. So more or less back to normality now. All right. Yeah. Thank you very much, Ryan. You're very good.